my dad's parents have 10 brothers and sisters, and my mother's parents are brothers and sisters as well. Last year at a grad party, I met an entire side of my family that I hadn't met before. But they hugged me and they loved me like they've known me all my life. That's what's so great about this organization. Brother Bill's Helping Hands' core values are based on faith and family, just like many of the families that they serve. When we were approached with a problem, we thought, what better way to address this problem than working through the neighbors that make this organization run. This is Carrie, this is Thomas, that's Claire, and I'm Jordan. And we're the team working to recommend strategies for Brother Bill's Helping Hand to fulfill their goal of doubling the number of clinic patients.
Brother Bill's is a faith-based organization operating out of the low-income zip code of 75212, which can be seen here. This zip code faces struggles of poverty, including significant high school dropout rates and a lack of strong community infrastructure. More than 1 out of 3 families in this area live below the federal poverty level, and additionally, 25% of households don't have access to a car. Lacking access to a car presents a significant barrier to healthcare delivery in the neighborhood. As a whole, West Dallas needs comprehensive solutions to help alleviate these healthcare delivery concerns and improve the quality of the healthcare in the region.
Los Barrios Unidos Community Clinic is located 4 miles away from Brother Bill's in West Dallas. Similar to Brother Bill's, Los Barrios provides medical care to the uninsured population of West Dallas. Los Barrios also serves the insured population of West Dallas, employs 8 physicians and multiple medical staff. Unlike Los Barrios Unidos, Brother Bill's Helping Hands takes a holistic approach to serving the West Dallas community. They do not only provide medical care, but also provide fellowship, groceries, and community building activities. Brother Bill's is also driven by a group of passionate and eager volunteers from around the Dallas community, as well as right in the West Dallas community itself. Brother Bill's also maintains a strong partnership with the Methodist Hospital that allows them to employ 1 full-time physician's assistant that is able to provide medical care in their clinic. In order for Brother Bill's to increase their volume of patients, they must play to their already existing strengths and take a holistic and community-based approach.
So the first thing that we asked ourselves when faced with this challenge was, what are the primary health concerns in the 75212 zip code? What problems are these families facing on a daily basis? After conducting extensive demographic research, we discovered that both smoking and obesity rates within this county are well above the national average. This is concerning for a number of reasons, but primarily in the fact that the proven correlation between low-income populations and the increase of smoking and obesity-related diseases tells us that this situation will only become worse over time without an effective intervention. Brother Bill's Helping Hand is particularly well-suited to handle the rise of preventable disease in the 75212 neighborhood, as they already possess a large and reliable volunteer base, a strong donor community, as well as strategic partnerships with local hospitals, schools, and apartment complexes in the area. So what is the solution? We'd like to introduce you to what we like to call the ACE program. We believe that Brother Bill's Helping Hand can help treat preventable disease within their community while increasing the number of patients they serve in their clinic by implementing a 3-pronged approach. First, we suggest that Brother Bill's train and certify a team of neighbors to become community health advocates. We envision these advocates to be an integral part of empowering the community as well as extending the overall reach of Brother Bill's. Second, we would like to suggest that Brother Bill's create a clinic-to-community program that will be aimed at bringing their services to where the neighbors actually reside. And finally, we would like to suggest that Brother Bill's implement specific programs aimed at empowering their neighbors to take control of their own health and tackle problems such as chronic smoking and losing weight. With these 3 approaches combined, we believe we can offer a strong and comprehensive solution.
A certification program would be implemented at Brother Bill's to become a community health advocate. Ideally, Brother Bill's would use their previous volunteer relationship with UT Southwestern Medical School and have a volunteer medical student teach the certification program. The certification program would be 4 to 6 weeks long, covering the magnitude of chronic illness in West Dallas, the impact of chronic illness in West Dallas, the solution to the problem, which would highlight healthy diet and exercise, and above all else, seeking preventable health care at Brother Bill's. Next, the program would cover how to educate the community about healthy diet and exercise and seeking preventable health care. And lastly, it would train these individuals how to take blood pressure and BMI in order to be an integral part of our mobile health teams. Ultimately, community health advocates will increase awareness of Brother Bill's clinic services, serve as vital members of mobile health clinic teams, help to implement the health empowerment courses, and be central to developing effective programs at Brother Bill's to increase community health awareness.
Our second prong, we recommend that Brother Bill focus on empowering the community to combat the two conditions that needlessly kill those residing in the 75212 zip code, obesity and smoking. By incorporating specific low-cost programs into the clinic, we can, number one, increase the amount of patients seen at Brother Bill's, and number two, also increase the presence and efficacy of our community health advocates. At the end of the day, our ultimate goal is to educate the community on the importance of health and preventable health practices. Health empowerment courses will encourage neighbors to make more appointments in the clinic, as well as encourage their friends and family to do so. Specifically, we recommend a clinic-wide incorporation of the Freedom from Smoking program that is offered at no cost from the American Lung Association. This program offers facilitator training for our health advocates, explains nicotine addiction, goes over the curriculum content and implementation, and how to conduct group classes. Additionally, our community health advocates will learn the skills and techniques that have been proven to help smokers quit. We envision the clinic providing an initial visit with patients to gauge their overall health before they start the program. This will help us set a very important metric for health. Then the community health advocates will be trained to run sessions and offer patient counseling as well as treatment options. Second, we recommend that the clinic incorporate an 8-week program for weight loss and wellness, which utilizes the National Institute for Health free materials. This program will incorporate an additional initial clinic visit upon enrollment to gauge starting weight, BMI, blood pressure, and cholesterol levels. Additionally, we suggest ongoing face-to-face weight loss counseling with the community health advocates and neighbor-led community exercise classes and wellness events in their neighborhoods.
The clinic to community part of our solution will be used to educate the neighbors about the clinic while also offering basic medical services. The team will be made up of 3 people: a physician's assistant, a community health advocate, and an employee of Brother Bill's. The mobile team will be able to travel through West Dallas and hit high population areas like neighborhoods, apartment complexes, and other high pedestrian traffic areas. The mobile team led by the PA will be able to check blood pressure, check a person's BMI, administer flu shots, and also schedule appointments to be seen at the main clinic. The mobile team will be most effective with bilingual speakers since much of the community speaks Spanish as their primary language. And we also suggest that the mobile team conduct their outreach every other weekend or twice a month in order to limit the interference with the other programs already taking place.
So given the time constraints necessary for implementation and scale of each of these solutions, we've developed a timeline that breaks down when we plan on each solution reaching its maximum potential. So from the outset, we'll begin the recruitment of our community health advocates. But after that, within 3 months, we believe we'll have incorporated the smoking cessation and weight loss program into our clinic. Within 6 months, the advocacy training for neighbors will have reached its full scale, and that'll be a sustainable operation. And then within 12 months, we expect the majority of our clinic to community efforts to have started working, and then at that point, we will have reached out to the community to expand services from not just the clinic but also other locations in the 75212 neighborhood. All right, so given those timelines for implementation, we forecasted the number of new neighbors using the health clinic over the next few years. So currently in 2015, there's about 960 neighbors using the health clinic. But after you see health empowerment and community health advocates starting within 1 year, we expect that to double. And then within 2017, once we've started reaching out to other neighbors in the community that may have difficulties getting to the clinic for transportation issues and the like, then we expect numbers to triple from their current state. So the percentage of costs we broke down based on what each solution will cost. So clinic to community is obviously the most expensive because that requires medical supplies for going out into the community, flu shots, and additional supplies that we currently don't have for mobile systems. But health empowerment and community health advocates, these will include educational materials, other, as you'll see on this next slide. Okay, and then so we have budgeted the solution for implementation costs over the next few years as well. So in 2016, these are the costs that it would take to run the next programs scaled out over the timeline that we suggested. So we broke it down into advertising, education, technical, labor, and medical supplies. The breakdown sort of as follows. And then when we go to the next slide, this is the total clinic cost per year. So that last slide was the cost of the budgeted services prior. This is the total community health clinic costs that we expect per year. So in 2015, you're looking, we got those numbers roughly from the 990s, but that's about $383,000 is what the community health clinic is costing roughly right now. And then when we expect to add in these new services, while also tripling the number of patients, which will have its own variable costs, we expect the cost to increase slightly, also including inflation. So given the fact that the costs are $383,000 roughly right now, and there are about 5,000 patient visits to the clinic per year, that's about $89 per clinic visit. But as we expect numbers to increase significantly over the next few years, we've broken it down, and we think our most optimistic forecast is $50 per patient clinic visit, which would be a significant drop in your total clinic costs. So although your financial costs are increasing, your per patient clinic costs are drastically decreasing.
ADPP is a health initiative in Angola that implemented community health agents in 2010. Community health agents are community members that have been trained to promote the treatment and prevention of HIV/AIDS, malaria, TB, and other illnesses in Africa. As of 2013, 444 community health agents have been trained, and they have made a total, in 2013, they made a total of 70,000 household visits and distributed over 300,000 condoms, and successfully brought health information to their local communities. ADPP Community Health Agents creates excellent evidence that our initiative in West Dallas will be a success.
We believe that the ACE program will be a cost-effective solution for doubling the amount of patients to Brother Bill's clinic. Through this program, Brother Bill's would be able to further strengthen their bond with the community and broaden their influence. By doing this, Brother Bill will be able to impact more lives and be a positive source of support that we all need. Just like John said in 1 John 4:11, "Dear friends, since God loved us, we ought to love one another." Thank you.
I've got two questions. The first one is, in talking about taking the clinic out into the community, which I think is a great idea, did you investigate at all what kind of cost it might be in terms of some kind of mobile unit or what you would use to, besides somebody's car?
Basically what we had assumed is that it wouldn't be cost efficient to buy a bus or some kind of mobile health van, just given the small geographic range. We looked at models like that have worked in other areas, and they required a much larger geographic area to be cost effective. Mm-hmm. So what we were planning on doing was just working out of a car and then basically having its mobile and most mobile sense with a fold-up table and some supplies. So that's something that we go out into different areas. You know, we have a pop-up tent, and then you just kind of you can set up in different pinpointed areas based on what's going on that weekend.
And then my second question was, and you may have said this and I missed it, on the community advocates, had you had any kind of number in mind as to a starting number? And
we did discuss that, and I think we were thinking that the original class would be 5 to 10, and the people in the class would go through a interview process. I think you mentioned that your skills training for young women, they get interviewed for that, if I'm correct. So it'd be like similar to that, and you'd really be targeting people that maybe already have community influence. So like integral parts of churches and members of churches in the area and things like that that already have ability to reach the community.
Well, I just had just a general question. I just want to make sure I get it. So it sounds like you're doubling the number of patients or number of clients over time, and then you're bringing the cost down from, I forgot the number, but down to 55 or something like that. What are you doing to bring the cost down and increase the number of patients?
Well, the increasing the number of patients we've done through the 3 solutions. So if you go, Harvey, go back a few slides here. Where do you go? So the one that has like the number of patients. Yes, this one. Okay, so when we look at each of these solutions, we sort of calculated out how many new neighbors we expect to sign up based on, if we said for clinic to community, for example, we said there would be about 2 families that would sign up per hour to utilize the health services, which is a reasonable estimate if you spend a few hours out in the field each day. These are new families. But for health empowerment, community health advocates, we looked at different previous studies, and we sort of calculated some numbers with just basic small level classes, how we can break out. And so what we're saying is that the majority of the costs that they're going through are overhead costs, and with more patients, obviously those costs are a lesser extent of the total.
So let me just make sure I understand. So the folks who are being reached now with the new health empowerment, or let's say the community health advocates, these are new people who aren't. There's no cannibalization, right? These are new people who weren't going to the clinic before.
So
is that right?
This is your current number of people in the clinic here, right. The blue. But these will be people that the community health advocates will help bring in. So it's more of the community health advocates themselves will come more from these initial numbers, and then they're going to help train.
Okay, so they're all okay. I think that answers my question. I was just making sure that the blue bar across, those patients are getting the same kind of level of treatment as the ones in green.
That's correct.
So the community health advocates aren't actually treating anything. They're just helping channel new people into the clinic.
Right.
Okay, and so then the question is, can the clinic handle that volume? I mean, the current staffing levels that the clinic can handle, did you guys check to make sure that they could?
The clinic is currently under capacity at its current form right now, and so we believe that it can handle those cases.
So I love the benchmarking, because I think it's a good reference point and makes lots of sense that something actually else works. Did you guys check these numbers against the success in other places? Because tripling seems aggressive, but if other, how did you arrive at tripling in 2 years?
Well, there hadn't been a previous study like this done in this particular area. So while we're optimistic about these numbers, it's hard to say with 100% certainty. But what we kind of looked at the success rates of individual programs that were similar in nature. So like when you aggregate all 3, the numbers, they might be a little lower. But when we looked at individual previous cases that had looked at health empowerment, additional health training, additional moving out into the community, and additional like sort of advocates advocating for health services. These are numbers that we could expect from those.
So from other initiatives, you feel like triangulates?
Yeah, exactly.
So I'm a little confused about, you presented Los Barrios Unidos, right? Unidos clinic as a contrast model, and I'm curious as to A, why you did that, and then B, are they really separate neighborhoods that Brother Bill serves versus the other clinic? And then a follow-up to that is, you presented this as a transportation problem for neighbors. Will that all be taken care of by the mobile, or are you expecting people to still get to the clinic? Lots of questions there.
Let me start with your first question. I think we started with the contrasting it to Los Barrios to show that they have a really big competition right in the area that is employing multiple physicians that Brother Bill's does not have. So that's why we really wanted to take this like grassroots approach and not just say we have these doctors come to our doors. And then remind me of your second.
Well, you said it's one of the issues is transportation or lack of transportation. So will the mobile clinic take that? Will that be all?
So when I met with Susanna a few weeks ago, and what she was saying that some people who use the clinic they'll have to walk or use bikes over 2-3 miles to get to the clinic. And so what we're hoping to do is to keep some of the current clientele that comes into the clinic already, but this will add an additional service that will allow them to expand out into, because it's an 11 square mile zip code, maybe reach some of those further corners than they've been able to reach in previous.
It was very fortunate to also have a board member from Brother Bill, who's also a physician I know would like to ask a question.
Well, so I was curious, your use of the community health advocates, as you're calling them, is a great model. And I saw you make provision for how to train them, but I'm wondering about like ongoing supervision and support of those individuals. Did you think about how that might happen? And if they bump into something in talking with a neighbor that is beyond what they as a layperson could address, how do they get help in dealing with that?
I think one of the main points is that the health advocates' main goal is to really promote seeking the preventable health care. So if they do run into a problem that they aren't certified to take care of, it would really be like, well, you should come to the Brother Bill's clinic and seek services. And then you kind of had a question at the beginning.
About supervision.
Oh, okay. Supervision. I think that it would be ideal to continue that partnership with medical students as well as the PA, maybe make something together. But if you have the medical students heading this up, they should hopefully be able to provide some oversight after.
We have time for one more question. Any other audience members? Yes.
I would just share that City Square did trained community health advocates for diabetes, and it was wildly successful, and they ended up testifying to Congress. So I'd say this is a model that has a lot of promise.
Thank you.
Thank you. Thank you very much. So thank you.
All right, thank you.